public transportation. If you wear a mask and I wear a mask, we are all safer. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. By order, under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. By order, under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed. Under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. By order, under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. Persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the disaster, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safe. By order, under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. Under the Disaster Risk Management, fever, flu-like symptoms, or any respiratory illness, By order under the Disaster Risk Management Act, stay at home. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, by order under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. By order under the Disaster Risk Management Act, you must wear a mask in all public access places. By order under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, By order, under the Disaster Risk Management Act, stay at home. By order, under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. If you have a cough, sneeze, sniffle, fever, flu-like symptoms, or any respiratory illness, by order under the Disaster Risk Management Act, stay at home. By order under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place shall not exceed 10 persons. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation.
You can put up the standby. Stand by, everyone. Stand by. Thank you. For those who are joining on media, let's do a 30-second standby for you. Good evening, everyone, and welcome to the Media Center here at the Office of the Prime Minister in Kingston, Jamaica. My name is Naomi Francis. Today, International Women's Day, March 8, 2021. Prime Minister Andrew Holness will preside over a briefing to the nation and, of course, entertain questions from the media this evening. The Prime Minister is joined by the Minister of Health, Dr. the Honourable Christopher Tufton, as well as the Minister of Foreign Affairs and Foreign Trade, the Honourable Kamina Johnson-Smith, both of whom accompanied the Prime Minister today to the Norman Manley International Airport to receive the first batch of vaccines to Jamaica. We also have with us this afternoon, or this evening, the Minister of Local Government and Rural Development, the Honourable Desmond McKenzie. We have as well P.S. Dunstan Bryan, the Permanent Secretary in the Ministry of Health and Wellness, along with the country's Chief Medical Officer, Dr. Jacqueline Bisaser McKenzie. And now, Prime Minister, the Most Honourable Andrew Holness.
Thank you, Naomi. Good evening, everyone. And before I start, today is International Women's Day, and I want to take this opportunity to wish for all our women a wonderful day, but in particular, our health workers, our doctors and nurses, and other frontline workers, to particularly wish for them a very productive, very happy International Women's Day. We truly do appreciate the work and the sacrifice that you have made. I'm also very happy to report to Jamaica today that this afternoon we received our first shipment of 50,000 doses of the AstraZeneca vaccine donated by the government of India. We express our deep appreciation to the government and people of India for this very much needed support. Our vaccination program will begin later this week, starting with our healthcare workers, as announced last week. And Minister Tufton, who's here with me, will give more details as to exactly how this will be rolled out. Now, based on the latest report from this morning, Jamaica recorded 878 new cases of COVID-19. This is the third consecutive day of record numbers, with 527 reported on Saturday and 723 reported on Sunday. Our cumulative cases of COVID-19 are now 26,904, and 454 persons have died due to the pandemic. I offer my sincere condolences to all who have lost loved ones. We have had 14,447 persons who have recovered, and our recovery rate is now at 53.7%. The number of active cases, that is the number of persons who still have the virus, is at 11,770. Now, yesterday, with 878 positive cases out of a total sample of 2,696 tested, this yields a positivity rate of 32.6%. However, the public sector test positivity rate, which is based on the more reliable PCR test, was 39%. And as was explained in our last press conference, after you have corrected for tests coming from the private sector sources and just accounting for PCR tests, you would have this number, which is much higher than the general testing that was done. I want to pause here to adopt Minister Tufton's new phrase, let that sink in. And without pleasantry, without being amused at the matter, this is very serious. We are now in the danger zone. And what is happening is that by virtue of our past success, by virtue of delaying this point for more than a year since the pandemic, there are those who believe that we have passed the worst. Yes, we are in the darkest hour of the pandemic. And yes, it will pass at some time. But exactly how that happens depends on how you, as an individual, as a citizen, as a worker, as a mother, father, you as the individual, it depends on what you do. some of you would have seen reports that we are now, for example, having challenges with oxygen tanks. You would have seen reports of persons going to the hospitals and not being able to get the treatment they require. Indeed, unfortunately, some have died. I've gotten the first-hand reports of persons who have gone to the hospital, having breathing challenges, showing symptoms of COVID-19, and were pointed to other hospitals because the hospital that they have gone to just simply had no beds. And there is a sense that this could not happen to me. Indeed, when we see the videos of people keeping parties in this period of time and people enjoying themselves, the sense that you get from it is as if to say, I am invincible. This couldn't happen to me because I am not in the vulnerable age group. You may very well not be in the vulnerable age group, but your grandmother is. The people that you work with are. Those that you take the bus with are. This kind of selfishness cannot be allowed to continue in our society. I've been very careful as your chief steward not to in any way give the impression that the authority that we have under law to restrict movement and prescribe how we gather and other such measures, not to ever give the impression that we are abusing them and that we are doing it because we can do it. We have always tried to be balanced. Whatever it is that we do in terms of measures, it has to be based on evidence. And as we have pointed out before, we look at two critical factors before we act. We look at the number of infections, well, three. We look at the number of infections, the positivity rate, and the number of beds. In the early stages of the pandemic, we acted on the trigger of the number of cases. You would recall when we put up that trigger line, when we just started to do the controlled re-entry. You will recall that when we decided to put in some of the quarantine measures in communities, for example, in St. Thomas and in St. Mary, we looked at the positivity rate. Now we are at that very critical trigger line, and that is the number of beds. Because this trigger line is directly linked to the mortality rate. If people can't get treated in hospitals, and obviously if you have to go to the hospital, it is because you have dire symptoms, it is likely that you could have a fatal event as a result of the lack of hospital space. So your need to party and be free and go about not wearing your mask has to be balanced against the need of someone who will be deprived of care because we simply have no beds. My conscience is clear that we have done all that we can in balancing lives and livelihoods. At this stage, the equation and the balance has now shifted to saving lives. You would have seen recently, but it has been the case, that there are those who would wish to challenge the authority of the state in ways that even the most liberal Jamaican would believe is a threat to the rule of law and the order and discipline, and indeed the justice of the society. We are all free people in Jamaica. Freedom is paramount. Freedom is the ultimate. Freedom is the Jamaican dream. However, we are not free to be irresponsible. With great freedom comes great responsibility. And as a citizen of this country, you have a responsibility, more than enforcement, more than compulsion, but a duty to follow the law. So, we are now in the danger zone. The numbers will continue to rise. It is the nature of the pandemic. I don't like to, call down the worst. But if we do not get these numbers down, it is likely that the mortality rate could also rise. So, in this phase of the management of the pandemic, the government has to remain strident. It has to remain resolute in the measures that we have implemented. And I wish to prepare the Jamaican people that if the numbers do not improve, then, as I had said earlier, there are other measures which we will put in place. These measures will have an impact on the economy. It will have even greater impact on your ability to move. It will have even greater impact on your ability to gather. It really depends on what you do at this point in time. The vaccines are now with us. We have our first tranche of vaccines, 50,000 doses, thanks to the selflessness, thanks to the kindness, thoughtfulness of the people of India. And I, again, wish to thank my good friend Prime Minister Modi for his consideration of Jamaica as one of the countries that should benefit from the vaccines. There's been much talk about how we go about getting the vaccines. I wish to say to the Jamaican people today, Jamaica is not a producer of vaccines. We don't have the technology and the manufacturing capacity. Jamaica, like many other countries in the world, we are in the queue waiting for vaccine supplies. We have made sure to set aside the budget to purchase vaccines. We are always following all the possible avenues to get vaccines. There are many countries richer than Jamaica, greater capacity than Jamaica, and they have not yet gotten vaccines. There are many countries that have secured vaccines, they have paid down on the vaccines, but they simply have not gotten the supply. It is the reality of the international vaccine supply and demand. Right now, we have secured the 50,000 vaccines courtesy of India. We will get another tranche, this time from COVAX, which is about 14,400. And then in a few weeks' time, we will get another 100,000. And that is from other avenues that we are pursuing. I want to assure the nation, your government is acting with the highest level of responsibility in this regard. Before we take on any vaccine, we have to be sure of its safety and efficacy. Sometimes the conversation is as if we can ignore that. And it always leads me to wonder, God has placed you here at the right time. Because were it others, what would they have done based upon what they are saying now? We know the skepticism that is abroad in our country regarding vaccines. And if we're going to overcome that skepticism, the only way to do that is to be certain in the procurement of the vaccine that we are getting the safest vaccine with the highest level of efficacy. We are giving you that assurance. So we know that there will be significant take-up of the vaccines. We are not rushing in a willy-nilly, unthoughtful way. We're being very careful and strategic in what we do. Now, the program will be unveiled in more details today. But like all programs, as we go along, it will be refined. As new situations emerge, as new priorities become evident, we will have to make adjustments. However, we have put forward the principles on which vaccines will be made available to the public in keeping with the recommended priority order by the WHO. We start with our public health workers, our doctors, nurses, the attendants and orderlies, and our CMO has provided that list and how they will be contacted and how they will be scheduled. All of that will be explained today. We then go on to our security forces, starting, of course, with the Jamaica Constabulary Force and then the Jamaica Defense Force. They will be in that first batch. And when that is complete or close to completion, then we begin to vaccinate the general demographic 60 and older. There are questions raised about whether or not politicians will get the vaccines before everyone else. A raging debate took place, and we saw comments coming from the medical community. And let me be clear, and I've always been clear with this and to the cabinet, that we must lead by example. And there are two examples to be set here. The first example is the vaccine is safe enough for the leaders to take. And the second example is that regardless of who you are in this society, once the rule is set, you will abide by the rule. So there are those who say the leaders must take it first, and then there are those who say, no, they must wait. You can't win. What they are saying, obviously, is that, a young 40-year-old minister should not take it before a 60-year-old. And there is merit. There is merit in the argument. But what I have come to understand about my own country and my own people is we have an incredible sense of social justice. What is right? For too long, our country, people have stood by and said, it is those who know others and who are connected. They are the ones who are going to get through. And the pressures have already started. But I'm committed to ensuring that the distribution of the vaccine does not fall in this category of nationally important goods to be distributed, where people break the line and because of connections they get. Because it is a life-saving commodity. It's a life-saving good. And so people must have faith. And for another reason, I know there are those who are saying they're not going to take the vaccine. I bet you any money that within the first 4 or 5 weeks of vaccination, everybody's going to want to come and take the vaccine. So you're going to have long queues and lines and people piling up. And if there is ever the view that the vaccine is not fairly distributed, everybody will want to break the line because they will feel they will never get. And indeed, that is the situation of scarcity and the distribution of things which have been described as spoils in Jamaica. We can't afford that in this exercise. This will be the largest logistics exercise that we have undertaken, except for mobilizing for a national election. And we cannot fail in this regard. So I think I've said enough. I'll invite the Minister of Health to come and tell us about the vaccines, and the CMO, I'm certain, will give support.
Thank you very much, Honourable Prime Minister. Good evening to my colleagues, members at the Ministry of Health and Wellness, distinguished ladies and gentlemen. Today is a good day. As said by the Prime Minister, we finally have gotten our vaccines and there's much work to be done. My first comment from the Ministry of Health, Prime Minister and colleagues and others, is that we are still very concerned, as you have expressed, with the increasing positivity rate, with March 7th representing our highest daily case count on record for the country, but more importantly, the positivity rate of well over 30%. Just to clarify that the numbers tells one story, and the public, I know, gets alarmed when they see high numbers. But the positivity rate is really the key variable to watch, because what that says to us is for every amount that we test, whether it is 100 or 300, the higher the percentage of positivity is, the more the virus is present within our population. And so a positivity rate of over 30%, in this instance, I believe closer to 35%, 39%, means that for every 10 person in the population, 4 are positive. Now, that is a graphic depiction of the extent of the virus in our population, and we remain concerned about that. The health team, we have met, discussed as we do each day, and there is a considered view that we will see high numbers over the next week or more, and we are hoping that we will begin to see a tapering off beyond that period, as long as persons obey the protocols that have been established under the orders and the message that all of us in government have been preaching around mask wearing, sanitizing, and physical distancing. So while we will clear up the backlog and therefore be testing less than the 2,000 or more each day over the next couple of days, we should get back to the current testing. We will likely still see positivity rates that are relatively high until we see the effect or the impact, hopefully, of persons observing the protocols. Beyond that, I want to report that we have received an update from the Caribbean Public Health Agency, CARPHA, where we have been sending samples to be tested for the COVID-19 variant strain. In January, we randomly selected confirmed positive cases from across parishes who had no history of travel to test for the variant strain, the UK or English variant strain. The samples completed the processing and we received results on March 6th. Of the samples sent, 8 were suitable for testing and 7 were found to be positive for the UK variant strain. The positive samples came from the parishes of St. Catherine, St. James, Clarendon, Kingston and St. Andrew and Trelawney. What this confirms to us in public health is that the UK variant strain is present in our population as manifested in the sequencing or the testing that has been done at CARFA in Trinidad. And I think it's important for us to recognize that, look at the features of this variant strain, which I know the CMO can comment more on, and could attribute, possibly, with more work to be done, more testing to be done, that this may have contributed also to the rate of spread in the population. Our analysis has shown that given the widespread disregard for the protocols, the non-wearing of masks, the crowded situations, the illegal parties and social gatherings across the island, and also the increasing indication of symptomatic positive cases, all of this combined could be contributing to the rate of spread of the virus in the population. The issues around the variant strain is concerning. I mean, it has taken us some time to get the results of these tests because we don't do the tests here in Jamaica. And so we are moving to ensure that we have the necessary equipment to allow us the capacity to test for that variant strain. I understand from the technical personnel that we will need approximately 60 million Jamaican dollars to acquire certain pieces of equipment which will be lodged at the public health lab, which will contribute to testing here in Jamaica for the presence of variant strains, and in this particular case would help us to assess the prevalence of this particular strain in the population. We're also moving, as said earlier, to look at an alternative source or another source for testing, not just at CARFA, but in the US, in Florida, and arrangements are being made to increase that agreement so that we can have testing for the variant strain in that location. I want to stress, and again, our technical person, the CMO, can comment more on this, that the presence of the variant strain really requires the very same response as is the case with the presence of the regular strain, if you will, in the population, starting with observing the protocols. That's absolutely critical. And also to say that the vaccines that we have received is in fact effective with dealing with the variant strain. So we just have to continue to follow the procedures, the protocols, and we will, if we are diligent to those protocols, benefit from controlling and overcoming the strain, both strains that are in the population based on the tests that have been done. I want to also indicate that our presence of workplace clusters, or the increasing discovery of outbreaks within the workplace, is a concern to public health. We feel that it is an indication that protocols at the workplace are not being followed diligently. And indeed, we want to remind employers, to the extent that you have to work from the workplace, that a review of those protocols be done to ensure that we minimize spread within that work environment. In Kingston and St. Andrew alone, the health department is currently managing some 46 active workplace clusters. And this is a lot to manage with limited personnel that we have. but it is an indication that we are having increasing numbers of outbreaks within the workplace. Onto hospitalization, the increase in the number of COVID-19 cases in the country remains a cause for concern from the perspective of hospitalization and the capacity of our health system to respond. Present state of hospitalization continues to be alarming. 13 of 22 hospitals across the island are in the red alert zone, which means that they have greater than 84% occupancy level for its isolation capacity. 12 of the 13 hospitals are at 100 or greater capacity percentage. The current hospital census shows Cornwall Regional Hospital, Annotto Bay, Port Maria, Mandeville, Maypen, Kingston Public, Princess Margaret, Percy Jr., St. Anne's Bay, University Hospital, the National Chest and Spanish Town hospitals have all exceeded their capacity to house patients who require isolation care. All 4 regional health authorities have 2 or more hospitals in the red zone, and the red zone, again, is 84% or greater occupancy. The Western region has 2 or 4 hospitals in the red zone and the other 2 in the amber zone. The Northeast region, 3 or 4 hospitals in the red zone. Southern region, 3 of 5, and Southeast region, 5 of 9 hospitals in the red zone. Across the country, the average number of daily admissions to COVID-19 isolation wards was 49 for the week of February 22nd to 28th. That has increased with the increasing rate of spread to 56 for last week. So 56 daily admissions for the week of March 1 to 7. So clearly going in the very wrong direction and adding to the stresses of the public health system. So our staff are experiencing stress and fatigue, as we have said. It is a difficult time for them. And again, this can be averted if persons observe the protocols. And I'll say again, as I've said before, expect longer waits. The instructions to our public health institutions is to not turn away anyone. As I have said, even if you have to triage and assess under a tree in the parking lot, we should do that. And I understand the perspective of the healthcare professionals. I know it's a difficult time, but such is the nature of the job. And I think for the overwhelming cases, they understand that and they're willing. What I'd ask on the part of the Jamaican people is to exercise some patience and understanding, because there's so much capacity and no more, so much room and no more. And we are likely to see the challenges associated with the overcrowding. I want to turn now to what the Prime Minister commented on, and that's vaccination. Again, to support what was said earlier, place on record our appreciation to the Indian government for the 50,000 doses of vaccines that have arrived just a short while ago. And we expect, is it this week or early next? Yes, this week. Another 14,400 next week, 14,400 from our COVAX facility, which will make a total of 64,200 in phase 1. And as was said earlier, there's a process. There are groups that are going to get priority in the first instance, or healthcare workers, the JDF, the JCF, and vulnerable groups who will be administered during the course of March. We expect in week 1 to administer some 17,050 vaccines. In week 2, 11,430. Week 3, 19,580 to make up the total. And the PS is going to come and put up a few slides to explain some of the finer details of the vaccine plan. There are still some questions that I know will be asked. On Thursday of this week, during our regular COVID conversations, we will go through in finer details the structure that has been established in terms of the vaccine plan and hierarchical structure involving functional management, oversight, the role of the regional health authorities, persons who have been specifically assigned to deal with logistics, to deal with human resources, to deal with the clinical side of administering the vaccine, the role of the private sector or private doctors, and I could go on and on. So this Thursday, we will go through that very important detail or set of details to give the public more information on this process. Before he comes, I just want to reiterate that we are making progress. And the comments that have generated alarm and perhaps concern, comments coming from myself as minister, is not intended to scare anyone, but certainly to explain to the country that there's a lot that we need to do, and all of us have a role to play. But I think the arrival of the vaccines is a good start to what I consider to be the most effective arsenal or effective response to COVID-19 and the virus, but it should not make us complacent. We must still wear the mask, physical distance, and sanitize, because there's still a fairly long way to go. I think we're getting there. What we need now is take-up. But in the meantime, please continue to observe the protocols. So I'm going to ask the PS to now just run us through a few slides with the permission of the Prime Minister, so that the country can get a better understanding of the breakdown.
Prime Minister, thank you, Minister. Ministers, colleagues, ladies and gentlemen, good morning, good afternoon, or good evening now, I'm sorry. I would just like to take the opportunity to remind my fellow Jamaicans about the principles that are around our vaccination program. The first principle is around human well-being, and our second principle is about equal respect. National equity, legitimacy, and reciprocity are the 5 main principles that we use to govern the operation of the vaccination program in Jamaica. Now, I want to remind you also of our supply program that sees us acquiring approximately 4 million doses of vaccine through 5 facilities: COVAX, the African Medical Supply Platform, our donation from India, our conversations with Moderna, and our conversations with the private sector. To date, we can program, and I want to remind us of the program for the next 3 months. We have now received the 50,000 in week 2 and not week 1. But as the Prime Minister pointed out, the plans continue to shift, some efficiency gains, some efficiency losses as we go from week to week. So now we have our 50,000 in week 2, and we will have our 14,000 in week 3. We still have an anticipation for a private sector source to provide 100,000 by week 4. And we still anticipate that in April, we will have 600,000 vaccines, and in May, an additional 210,000 vaccines. So within this space of 3 months, we still anticipate that our supply side of our vaccination program will be able to provide us with approximately 975,000 vaccines for us to inoculate our population. And of course, which our vaccination program, just to remind all, is in the 3 phases. Phase 1 being our priority group, which includes our healthcare workers, the elderly, Jamaica Defense Force, Jamaica Constabulary Force, schools, our government officials, Department of Correctional Services, PICA, and Jamaica Customs Agency. Phase 2 now moves into our economic sectors, and phase 3 moves into our general population. Now, in terms of the rollout of phase 1, we will see in March four groups of persons receiving vaccines. We start with our healthcare workers, and in March we will also provide approximately 25,000 elderly in infirmaries, elderly in homes, and other persons who are deemed in that 60 and over age group that can access our vaccination program in March. And the Jamaica Defense Force and Jamaica Constabulary Force. So in this month, in phase 1, we intend to vaccinate those persons identified with some efficiency loss and some efficiency gain. In April, we then roll out to the wider population of the elderly and our educational institutions and persons working in educational institutions, and of course the other uniform groups. March, April, first dose, then May, June, second dose. We move then into phase 2 of our program that looks at the economic group, and then phase 3 that moves into the general population. But what happens on March 10? As per the standard, we indicated that the vaccination program will begin 48 hours after receipt of the vaccines at the airport. Therefore, our schedule is for us to begin our vaccination program on Wednesday, March 10. And if we go to the slide that points out the weekly schedule of vaccinations, next slide, next. We'll see that on Wednesday, approximately 3,280 persons will be vaccinated. Please note that the vaccination program is always in groups of 10 for this first phase in March, because the vial comes with 10 doses in each vial. And therefore, in order to prevent wastage, we always have to round up in terms of our dispensation to factors of 10. And so you'll see, so it's not just because we want to round up, because we're estimating, but we have to manage supply in a way that maximizes the dose per vial. So week 1, we intend, as the minister said, to inoculate 17,050 healthcare workers. Week 2, 11,430 healthcare workers. But in week 2, we now will also be inoculating persons from the JDF and the JCF. And then in week 3, we continue the inoculation of healthcare workers, the JDF, the JCF, and then we begin to introduce the elderly population in week 3. So we have separated our estimations or our targets into our health regions. So the Southeast Regional Health Authority, the Northeast Regional Health Authority, the Southern Regional Health Authority, and the Western Regional Health Authority. On Wednesday, in week 1, these health facilities will be open for the inoculation of healthcare workers only. And we now introduce the logo for our vaccination program. Thank you very much. Prime Minister.
Thank you, Minister. Thank you, Pierce Bryan. I'm going to ask the Minister of Local Government to give us a brief on the meetings that you have had with the sector dealing with burials.
Thank you, Prime Minister, colleagues. in response to the concerns raised by the afterlife industry. A number of meetings have been facilitated since Friday into today, where frank and open discussions took place amongst leaders in the sector. The government is sensitive of the concerns and the realities facing persons in the sector, and as the country is aware that the ban on burials came into effect today. Arising out of those discussions, we heard concerns about persons who are employed in the industry providing service in the preparation of digging graves and building vaults. We consider a proposal which we will be considering, and when I meet with the industry again on Thursday to continue the discussions, a number of issues have been placed on the table. We are considering to provide a financial grant to those persons who will be affected because of the ban that is placed on burials over the next 2 weeks. And this grant will be provided to those who I said before are responsible for the construction of the graves and the digging of the graves and the building of the vaults once we have agreed. The other area that we have been discussing that we will advance those discussions on Thursday is the burial or the cremation of bodies that are in an advanced state of decomposition, the burial or cremation of bodies that are not in an advanced stage of decomposition but have been recommended for immediate burial by the appropriate health authorities, and the burial or cremation of indigent persons who die in the custody of the state. Many other proposals have been placed on the table, and as I said before, these discussions are ongoing. We will meet again on Friday to examine the remainder of the proposals, and then we will give a definite signal to the industry based on the 4 areas that I've just outlined a short while ago. Let me again state that the ban on burials came in effect today, and it will last for 2 weeks, but the discussion still continues with members of the sector. That is just a brief overview, Prime Minister, of what has been taking place since the announcements.
Thank you, Minister Mackenzie. We've reached the end of this segment of the press conference where we present the various reports, and we are now open to questions.
Thank you, Prime Minister. And thank you so much to members of the public. We do have some people on social media who are posing some questions, but of course, as usual, our media partners are the ones who are online who have several questions. Ahead of us starting, I did explain to our media partners that we're using the Zoom webinar platform, which gives a little bit more reliability in terms of how we stream. And so all they need to do is use the raise hand feature. Once we identify them, they will be able to ask their questions, and so and to turn their mics on. And so let's start off with Brittany Clark from Nationwide Radio. Brittany, and then I'll tell you the lineup so that you can know on your end for the journalists who made that suggestion, you'll be able to know on your end who is next. So let's start off with Brittany Clark from Nationwide Radio.
Hi, good evening, everyone. All right, my hand wasn't raised as yet, but since I was called upon, I have just one quick question. In relation to the COVID-19 variant, the UK variant that was now confirmed, of course, among the persons who have no travel history, is it safe to say now that the Ministry of Health and Wellness is saying that that is probably a direct link to the reason for the spike in the cases or the rapid spike in the cases over time?
The CMO will address that question.
Good afternoon, everyone. There are several factors that is contributing to the spike in the number of cases, and I believe, and the ministry does believe, that the most important part of that is in terms of the adherence or lack of adherence to protocols. Certainly, if we have what we have seen with having this variant in several parishes, is that it may contribute, and it should contribute, to more transmission in those areas. And of course, there's also the fact that if you now have 2 strains in the country, then there's also the possibility that persons can become infected again with a different strain. So there are reasons to believe that it can contribute to the spike, but the important thing is that regardless of whether it is a more transmissible variant, it is the same measures that need to be put in place to control. And if we do not put these measures in place, regardless of the variant, we're going to continue to have exposure and risk.
I'm sorry, Brittany is now indicating that she has a quick follow-up, so we'll allow that, and then we go to Ms. Dion Jackson Miller next. So, Brittany, is it that
Thank you?
Okay,
Thank
go ahead.
Yes, so the follow-up question, or the question I have for Prime Minister Holness, Prime Minister Holness, you said we're now at a trigger point, and we know that the numbers are increasing, persons are not abiding by protocol, and now, persons would have come with the anticipation that we're awaiting stricter measures. When exactly would you say that you'll be willing to now implement these stricter measures? Thank you.
Well, you're in that phase. We continue to observe the impact of the measures that we have already put in place, which, it's very much a mixed signal. We put measures in, and we put them in on the Sunday. By the Monday, a host of complaints by all kinds of stakeholders saying, I am going to be disenfranchised or disadvantaged, or my freedom is restricted. It's as if the question was, why put in these measures? Now we're in a situation where I guess it is explicit now. It is clear that there is an immediate danger. And so the argument has shifted. When are you coming with stricter measures? The government has always acted based on evidence, based on data. So we have always been evidence-based. We have always acted in what we call a situationally appropriate way. So we look at all the elements that make up the situation, and we try to come up with a solution that best addresses all the issues. And then we act proportionately. We don't act more than what is necessary. We gauge our response to how we have defined the problem. So where we are now, the measures we have put in place, we have given 3 weeks for them to work. If they don't work, then there would be more measures to come. And I'm being upfront with the nation to say, as I've always said, a lockdown is not off the books. We have never been this close to it, but we are very close to it now.
Thank you, Mr. Prime Minister. Let's then go to Dion Jackson Miller of RGR. Dion, I think you're on mute. You need to now unmute yourself.
Oh, actually had clicked. It just
You
didn't
caught us this
register.
time,
Thank
right?
you.
It's you. All right.
Thank you so much, Naomi. Mr. Prime Minister, you speak of taking the possibility of taking additional measures if the cases continue to increase. But 1 year into the pandemic, can you explain why the government hasn't implemented legislative measures that would allow for the imposition of ticketing and fines for not wearing masks? That's one question. How much longer would you be calling on people to wear masks instead of actually taking actions to try to have it done? That's one question. My second question has to do with a comment that the Jamaica Medical Doctors Association made on our newscast this evening. She said, and I quote, "Many of our members are still not fit tested and have to continue to work. We have interns," she said, "calling out for guidelines of how to resuscitate patients without proper gear. When you resuscitate patients, the risk of COVID is very high. And in this case, many of our doctors do not have fitted N95 masks, and they're watching their co-interns drop like flies from COVID." End of quote. So there are two parts to that question, because I acknowledge the issue of fit testing is one, and the issue of the availability of the mask is the other. Given that a doctor said to me that it's shocking to hear this, he said the process to do fit testing is simple, quick, doesn't take any fancy, expensive resources. Can I ask why 1 year into the pandemic, we still have doctors working who have not been fit tested? The second part relates to the availability of the mask. We don't seem to hear much about this. I know there's a worldwide shortage, but is the government moving earth and heaven to ensure that we get masks, because our healthcare workers are clearly being put at risk by their own description? So that's the issue of the ticketing and the fines, the issue of the fit testing itself, as well as the issue of the masks.
I'm glad you have brought these two issues to the public fore. I did not personally hear the comments of the medical professional who spoke, but I wish to say to all the medical practitioners, the frontline workers, that your sacrifice is very much appreciated, and we don't take your suggestions, your concerns lightly. I'm going to ask the CMO, or probably the permanent secretary, but more likely the CMO, to come and address it. But to the point, yes, the government takes these concerns very seriously. And aside from making the budgetary allocation, which we have done, and that is not, I doubt it, PS, that would be the issue, the budgetary allocation. We have made the budgetary allocations. It would probably be supply and logistics issues, but the CMO would be in a better position to answer you on those questions, Dion, and she will come shortly. Like you, I'm also very frustrated sometimes with the legislative process. As you can imagine, it is not always a straightforward one, and there are many competing views. Some people will say, the law is a competition for the best view, and that sometimes you don't settle on those views immediately or lightly. They take deep analysis. But let me be clear, however, that the existing laws do allow for some level of enforcement of the Disaster Risk Management Act. We contemplated ticketing as a more explicit and efficient process of enforcement. There are some issues with that. I won't go into those details now as to how the ticketing would be implemented. We are very close to putting that legislation in now, as I had promised that it would come within the first week of the new budget year. So the whole ticketing process is now at our legislative committee, which is the penultimate stage before it reaches Parliament. So we are on track, and yes, I agree with you, it has taken a long time, but as an attorney yourself, you would recognize that some of these issues have to be thoroughly debated before we can come to the legislative conclusions. But there are other measures which will require legislation as well, which we are contemplating in a meeting with the churches recently. And I have to give them credit for this. You know, they pointed out that the enforcement is not only against the individual not wearing a mask, which may prove difficult in certain circumstances, but really there needs to be greater enforcement against institutions, meaning, you know, business places and other such places where persons gather to transact business or for social interaction, that there should be a burden imposed as well on those persons who host or have such spaces. So that is also now being contemplated as another more explicit means of enforcement. And I'm glad you have raised the issue, Dion, about enforcement. We've been very careful not to impose too much on the public's freedom. But I believe we are at a stage now where, you know, our very cautious approach to it, we now have to be far more assertive in the enforcement of the protocols, because it is now putting the entire public good at risk.
I believe the CMO, sir, would now respond to the question.
Okay, we have come a long way since last year, March, and we're in a much better position than we were, I would say, a couple of months ago in terms of supplies and our ability to be comfortable with the amount of supplies that we have. We really made a particular effort coming into the end of the year to ensure that we had stockpiled quite a bit of personal protective equipment in preparation for the surge. However, we do understand that there are going to be times that they are certain, because there's such a wide range of masks that there are going to be times that you are going to have masks you're short. But we have not had reports, because we have meetings with the regions every day, and we have not had reports of any wide-scale lack of personal protective equipment at this time. Although I do say that from time to time you're going to have particular sizes that you may be out of. Now, that poses a problem with fit testing, because the fact is that you fit test for what is available. And you may find that you start out in March and you do fit testing for A, B, and C mask, and then 6 months later, there's no A, B, and C mask. And so your entire team need to be fit tested again. When we started out with the pandemic, the Ministry of Health had guided the fit testing process because we wanted to get everybody on board quickly and have all the hospitals covered. The regions have taken over the fit testing, in arranging the fit testing. So I'm not sure where they are in terms of if they have to fit test persons again. Earlier on in the pandemic, we did have problems. It is a simple process, but it requires a kit. And we did have problems with obtaining the kit. And so there was a gap about in the middle of last year where we could not fit test persons because we had no kits in country. However, at this time, I'm not sure if that is the issue, because it really has become the regions that have taken on this process of fit testing. But I hear what you say. I heard the report on the news this evening. I was a little surprised at the report, but I wasn't shocked, because the fact is that management issues, local management issues management has to address the problems that are faced in every institution, and it's going to be different from institution to institution. So, I would really just encourage persons, all the teams on the ground, to ensure that everybody is a part of the team and that we are listening to what our healthcare workers say at the head of department level, at the head of hospital level, at the head of parish level, so that we can address these issues. because particularly at this time, if we don't have the strength and the support of the healthcare workers, if they feel as if they are not a part of the team and their concerns are not being addressed, then we're bound to fail, and we cannot afford for that to happen. So I'd really just encourage, coming out of the report that I heard on the newscast, that the local management teams get involved and try to solve these problems. From a ministry level, we continue to engage in ensuring that we have adequate amount of PPEs in Ireland.
Thank you, CMO. Today, I suppose, we'll do some quick follow-up. So Mrs. Jackson-Miller had a quick follow-up, so let's just do the quick follow-up now. Maybe a little bit more efficient this way, too.
Thank you so much, Naomi. I hear what you've said, CMO, but given that we are in a pandemic and given that the lives of these healthcare workers are at risk, if the ministry is hearing these concerns coming from the regional and the local level, don't you think it's time for the ministry to step in? Because clearly what you're calling for isn't happening in terms of the matter being resolved at the local level, or we wouldn't have these calls coming from the head of the Jamaica Medical Doctors Association. So is it not time for the ministry to take a much more active role than to simply say we encourage the regions to fix this?
I'm not going to attempt to answer on behalf of the CMO, but since it is a management, it has been reduced to a management issue. That is something that the government, from the level of the cabinet through the minister on through the permanent secretary, will address. As I've said, I'm hearing this issue being brought through the media to the attention of the government. We are very, very sympathetic and always very concerned when these issues are raised, and I will personally ensure that it is addressed along with the Minister of Health.
Thank you so much, Prime Minister. Mindful of the time, let me just go to a few from social media, then we come to Nadine Harris-Wilson. Nadine, if you could remind us the media entity. But before we get to Nadine, Prime Minister, there's someone on Facebook who's asking, for persons with chronic comorbidities, asthma, high blood pressure, diabetes, etc., who are not elderly nor frontline workers, but still very high risk, which phase do they fall into?
I'll ask the CMO to address that.
For this group of persons, we are going to have to be dependent on our providers to submit, because our providers are submitting the list of names of persons who they have within their practices that are both persons that are elderly persons, and we would encourage to say persons with comorbidities as well. From the public sector perspective, we are using the chronic disease registers, and so we would not only be looking at the persons that are over 60, but the persons who would be registered as having chronic illnesses as well. So I would encourage the private practitioners who are submitting their list of the elderly persons to also submit those persons who have the comorbidities.
Thank you so much, CMO. Then let's get to Mrs. Nadine Wilson-Harris. Nadine, good evening. I believe this is the first time you're joining us for this press conference. If you could just remind us of the media entity you represent.
Good evening, everyone. My name is Nadine Wilson-Harris. I'm from the Gleaner Company. All right, so I only have one question. Would like to find out, do we have sufficient health officials, particularly nurses, to assist with the vaccination rollout? I get to understand that some nurses haven't been turning up for the training sessions.
I'll ask the PS, you take this one. PS Dunstan Bryan will address this.
Thank you, Prime Minister. To date, some 580 persons have been trained to be part of the entire vaccination program, and the training continues. Now, in terms of nurses not turning up for training, we have not received that report in center. As a matter of fact, we have had several training sessions over the last 3 weeks with full participation of different types of healthcare workers that will be part of the overall implementation. So we will investigate that to determine the veracity of that report.
Thank you so much, Permanent Secretary. We have 2 last questions that we will entertain given the time. Then let's quickly, one question from Ms. Burton, and then the Gleaners, Damian Mitchell. We can wrap up. After that, there are 2 comments, sir, Prime Minister, on social media. One having to do a real question, asking for air traffic controllers to be part of the essential services sector that would be vaccinated along with PICA employees.
We'll take it under consideration.
Thank you so much. Let's go to Ms. Burton then. Zara? Ms. Burton? I'm not hearing or seeing Zara. Then let's go to
I think
Damien.
her mic is on mute. It's unmuted now?
I just came off.
Oh, boy, I tell you guys, come on, sharper. Mic's on mute. Good evening, Zara. Your question, please.
Hi. Sorry about that. My questions are for the Prime Minister. Prime Minister Honus, can you speak to the issue of the Jodianne Ferron investigation and where we are with it? I wanted to know, for instance, if there has been a report produced at the administrative level that could be shared with journalists. That's one. Next is, and I'm asking because I believe it was you who had ordered the investigation, I think. The second question is about, again, the data breach. When Amber Group gave the Jam COVID app as a gift to the government of Jamaica, as it was reported in the papers, the data being retained, do they get to use that data for their own uses in return for it being free?
Those are your 2 questions?
Yes.
Let's start with the Jodianne, very terrible incident with Jodianne Ferron. I obviously was not prepared to address that issue today. My recollection is that there was a police investigation, and from that a report would have been done. I'm going to ask the Minister of Health if he has further information to just bring it to public attention. But what I will do, Zara, is I will go and find out further, and at our next press conference, I will update. Would that be satisfactory?
Well, just because the minister is there too, you were saying, so maybe he could give an update as well, just in case he has one that's more
no, I'll ask the minister to come. I doubt he will have any more to say on it. Our policy is always that we try to be properly briefed before we speak. But we'll try to provide you with the information because obviously it is something of public interest. As it relates to the information that is collected on Jam COVID, I recall that you had asked questions about tracking data, and we had committed that that data would be deleted from the system after quarantine ended, and that is the case. As it relates to other data, even though it is on the platform, it is not the property of the developer. It is the property of the government of Jamaica. And that data is treated and dealt with under the various laws that exist to protect the data of Jamaican citizens. The data is still valuable and still being used to track the pandemic and to have general understanding of spread and use in our contact tracing exercises and so forth. So at the end of the pandemic, the individualized data certainly will be deleted from the system. Of course, the general information, the total numbers and so forth, those would still be of statistical value.
Thank you so much, Prime Minister. A final question then comes from the Gleaner Company, Mr. Jovan Johnson. Good evening. Is it Jovan or Damian Mitchell? One of the two, I believe. So I know the Gleaner had their hand up. Are they forfeiting their opportunity to ask a question?
Hello?
All right. Who's on?
This is Damian. Are you
All
here?
right. Mr. Mitchell. Yes, so that's you
Yes,
with the
ma'am.
last question. Good evening.
Yes. Can you say, probably the CMO or the health minister, whether there is any investigation or indication as to whether the current vaccine is effective against the UK variant? That's question one. And my second question is for the Prime Minister. I heard your appeal last week, sir, for personal responsibility in the COVID fight. But weeks earlier, you had also said that the time for moral suasion had ended. How satisfied are you then with the level of enforcement of the COVID containment measures since that pronouncement by you that the time for moral suasion had ended?
Damian, I'm thanking you for the question. I'm going to ask the CMO to just come and quickly answer you on the AstraZeneca one. I believe that's a fairly simple answer. The CMO had addressed it last week, and then I'll come back and address the question you've asked.
Yes, so we have been seeing data that have shown that the AstraZeneca vaccine is in fact effective against the UK variant. Even up to last week, we saw data coming out of the UK that showed that the AstraZeneca vaccine is both effective in the elderly population as well as in cases where you have the UK variant.
Damian, much has been said about enforcement. And this pandemic has been a test for Jamaica's legal system. It's a test for our law enforcement system. And it is a test for our society. What kind of society do we have? Is this a society where the law presumes the reasonable man, and therefore the action of the responsible and reasonable citizen would not need a high level of enforcement? As the government, we have to be very careful how hard we push, because there are many social issues that could lead to adverse reactions from the population. People are out of jobs. The psychological and emotional impact for being restricted from having fun and having the ability to move around freely. The constant, flow of news that can really bring people into a state of depression. And one has to be very careful how you then pile on top of that an aggressive and overly assertive law enforcement strategy. So the ultimate tool in a free and democratic society is the government's ability to appeal to the reason of its citizen. What we have seen demonstrated over the past few days in videos being circulated and in those who should know better breaking the law is a high level of unreasonableness, especially in the face of the numbers that we have seen. And it is not for want of the government giving notice, advising, explaining that if you take certain actions, if you behave in a certain way, this will be the result. So government's enforcement strategy, therefore, has to be explicitly justified, because someone will take you to the courts to say, you have abused my rights. I have a right not to wear a mask. And who knows, they might likely win in the courts. And then what would that do to government's enforcement? So we have to be very careful. We have to be very strategic in what we do. And we have gotten this far in maintaining a very considered approach. But where we are now is that the public good is threatened. It can't be the case that the individual right rises above the public good. Where we are now is that we have to place the public good, the ability to get treatment in a hospital if it should become the case that you need it. That must take precedence over your convenience and comfort to be able to go to parties and gather as you would wish without wearing a mask and social distancing. And because it is absolutely clear in the public's mind now, and clear to the government and to the police, we will start a more assertive campaign for enforcing the protocols under the Disaster Risk Management Act and other pieces of legislation which govern public order. I must at this point commend the police for the incredible level of, I don't want to say tolerance, because you cannot tolerate bad behavior. Must not be tolerated. They didn't tolerate it, but they exercise a high level of judgment. It is not that those persons who wantonly break the law will not be prosecuted. The question is how and when, and if you do it in such a way to take away your own justification in enforcing. And I think that the police has been under a lot of strain lately. I have spoken to a few of them and they have expressed incredible frustration. You know, they have gone, they have enforced, and by the time they go before the courts, persons are back out, and they just feel as if they are powerless. No society can progress without having a strong law enforcement capability. And no society can progress without that capability being used with great consideration. What must be clear to the Jamaican citizens is that your government respects your rights and will only use any form of force unless it is justified. I am of the view, certainly the Cabinet is of the view, that it is justifiable now to be more assertive in the enforcement of the protocols that are in place.
Thank you so much, Prime Minister. Thank you so much, ladies and gentlemen of the media and ladies and gentlemen of the public, for joining us this evening for our media briefing and, of course, heralding the first batch of vaccines that arrived in Jamaica for our inoculation exercise. Please be reminded that the presentations, especially by the Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Bryan, outlining the centers for vaccination and also the schedule in terms of persons to be vaccinated, can be found on the Ministry's website. We thank you so much for joining us. Please remember the protocols, social distance, stay safe, and of course, if you're not feeling well, please stay at home. Thank you so much, everyone, and we'll see you again sometime soon. Good night.
By order under the Disaster Risk Management Act, stay at home. By order, under the Disaster Risk Management Act, you must wear a mask in all public access places and in public transportation. If you wear a mask and I wear a mask, we are all safer. By order, under the Disaster Risk Management Act, maintain a safe social distance of 6 feet apart. Under the Disaster Risk Management Act, gatherings in any public access place